Hello, Scurry County. Dan, County Judge. I'm here with Jason Tyler, our Scurry County EMS Director. We're going to give you a daily briefing and talk about what Scurry County EMS is doing during all of this COVID pandemic. So in Texas, total tests is 133,226. Currently in the hospitals in Texas, 1,176. It was over 1,300 yesterday, so that looks to be coming down. Cases reported in Texas is 13,906. Just for some information, the first case in Texas was March 9th. In the U.S. today, we have 576,695 cases. Just to kind of give you some numbers for just additional information. Fatalities, 287 in Texas, and the U.S., 23,068. Patients recovered. This is some information that's on the DSH website. 2,269 patients have recovered from COVID. In the U.S., 42,223 have recovered. The counties reporting 178 of 254 counties in Texas. In Scurry County, we've had 45 tested, 3 are pending, 40 have been negative, and we've had 2 positives. There's been some questions about what information we can give as far as what the 2 positives are. Not a whole lot. I can tell you that one is a male in his 50s to 60s. The other is a female in 50s to 60s. That's it. That's all I can give you. HIPAA will not allow any further information to be put out there as far as who the patients are. So is there anything else that you want to add to that, or?
No, that's about it on the counts. The counts are accurate. We're communicating with the health unit and the hospital and all the other entities to get the latest information and get the latest information to Scurry County.
Good deal.
So
great. Jason, I want to thank you for being here.
Yeah, thank you for inviting me. Appreciate it.
Absolutely. Let's talk about what EMS is doing.
So Scurry County EMS, since we heard about it just about mid-spring break for us, we started really planning hard. Of course, we've already been prepared since the Ebola crisis and a couple other flu scares throughout the years. Each one of our employees have PPE bags that are issued to them. Comes with a set of masks, gloves, extra shoes. We have Tyvek and Tycam suits that we have for us that we can put on depending on the level of decon or protection that we need, along with some gowns and face shields. So this particular case for the COVID-19, the standard PPE is gloves, face mask, and eye protection. If we know that we're transporting a COVID patient or a potential COVID patient, we'll go ahead and put a gown on and along with a face shield.
Yeah.
Those are the CDC recommendations for that, and it's been keeping us safe thus far. We've been able to respond like that. So most of you guys that we've ran on our patients have only just seen us with gloves on.
Right.
Generally, that's it. Now we're responding to every call. Basically, everybody is considered a COVID patient until proven otherwise in EMS.
Good.
Because we just don't know. And so we'll respond with a mask, a gown, or sometimes a gown, gloves, and either eye protection or a face shield, safety goggles of some sort.
Right.
If you have some of the signs and symptoms, so your cough or respiratory depression or distress in any form, we'll go ahead and put a gown on. We'll probably put a face shield once we get in the back of the ambulance. We're still going to provide the same level of care.
Right.
We're still going to treat you the same, just like we always have. It's just we probably look different with a mask on.
Sure.
And some eye protection. That's for your safety and ours. If you do have a cough or if you do have some sort of respiratory compromise of anything, we're going to put a mask on you. So we'll go ahead and put a oxygen mask on you or a nasal cannula like we would normally, and then put a face mask over top of your nose and mouth. And that should protect you, that's protect us,
right,
and kind of keep the spread if something were to come out. So those are a couple changes that we're doing.
Yeah.
Because of the Texas Department of State Health Services Emergency Fund grant, we were granted an ambulance that came with a cot and a power load system, and it's a Ford Transit, so you may see it running around. That was a free grant. There's no cost to the taxpayer, which allowed us to take our Chevy van Type 2 and use it as kind of a infectious control or COVID transport van.
Okay.
So that we're only transporting patients in long-term, such as Lubbock or Abilene, and our interfacility transfers in that truck.
Right.
So we're only having to really decon one truck, even though we're deconning our trucks every day now, and after every call, we're using UV light. We have 2 UV lights that we're running in the truck. We're also using a chemical to spray it down. We let it sit for a couple of minutes, and then we'll wipe it down.
Okay. Go into the UV light a little bit. That kills germs, doesn't it?
Yeah, it kills everything in that truck. It just, the shadow stuff, things that's shadow, it may not get because it's a light, and anything that light touches, it's going to kill. It's got a 15 to 30 minute time frame.
Yeah.
So then we go behind it with a spray and spray everything down in the shadows, and then leave it for 2 minutes and then wipe it off.
Okay.
So that then kills everything. Everything that we have on the truck is rated to kill COVID.
Right. And
so that means every time we're putting a patient in the back of an ambulance, you have no fear that you're going to catch something, because we're taking extra measures to decon the trucks more than we ever have, really.
Right. Okay.
So,
well, that's good to know. 2 things really caught my attention on there. All right. One, you said that in their bag they carry extra shoes.
Yeah. So sometimes our boots will get stuff on them.
Sure.
And we may not get them off. We may have not time to get them off, so we can slide off our boots and put some different shoes on. Sometimes we have some our work boots, maybe big and bulky,
right.
And the booties that we have to get into, it's easier to put just shoes on and then slip those booties over.
Okay.
So that's an option that each employee has.
Okay. It was just something that caught my attention when you were talking about that. The other thing that caught my attention, and I did this the other day, I mentioned both of them because I knew I would forget one of them, and I think I've forgotten the other one right now. So no, the other one was, you were talking about when you go pick someone up, you're going to be extra protected. You're not going to treat them any differently if they're a COVID patient. You're not going to jump back and go, "Oh, this is COVID."
Yeah.
You know, I think that's kind of our concern out there is how are we going to be treated when we go along as if it's suspected that we might have a potential case.
So we put ourselves in our patient's shoes a lot of times, and we're going to treat others as we want to be treated. And so we're not going to do that. We're going to come in. We may only send one medic in at a time to assess you, to kind of determine what level of PPE we may need. But as far as the care in the service that we provide, it's still a public service model.
Right.
So we're here to serve our community in any way we need to in the pre-hospital care realm. And so if you need care, you're going to receive it. If you want to talk about your ambulance bill, you want to talk about something, we'll come over. That's like we always do, and we'll talk about it and go from there.
That's something that you've talked with me about before, is some of the extra little things that y'all do that I don't think you get from other ambulance services, like going over and talking about the bill, or going over and helping someone out with something that's not necessarily medical related.
Yeah, we work along with other entities, like I said, the fire department and the health unit, and we provide a full area of care. If that means lifts, assists, we'll help you. We'll go over and we'll lift you. That's no charge. If you have a question, blood pressure checks, we do those. We're not currently doing a whole lot of those, but if we'll still respond to your house and check on you. If you're not feeling very good, we'll come over and check on you and check your blood sugar, and a lot of those things, those are all free of charge services.
Okay.
We'll come over, we'll do, if you fell, we'll bandage you up and get you back going. If you don't want to go to the hospital, and that's fine. We have a form that you fill out, which is our no transport form. And then, but we don't charge you for those type of things.
Right.
So it's a public service type model.
Yeah.
Where a private service model would definitely charge for a lot of those things.
Sure. So something that I thought about in all of this is everything is COVID right now. Everything's about COVID, and that is all that's being talked about. We're not talking about all the other calls that y'all have to actually go on a regular basis. So even though we're talking about COVID, 99% of what you're doing has nothing to do with that, correct?
Right. So a lot of the stuff that we're still doing, yes, we're taking extra precautions. We're still running, just like I said, all patients are considered a COVID patient until proven otherwise. But we're still running cardiac arrest. We're still running possible strokes and diabetics and those type of requests for service. We're still running.
Yeah.
And we're still treating those just like we always have.
Right.
It's just more of a high sense of awareness as far as the COVID-19. So we're going to be looking for more for those respiratory stuff. Now, we're not going to give breathing treatments like we usually do.
Okay.
A different care level is we'll probably ask to use your meter dose inhaler and give it through a different form to keep the droplets down.
Sure.
So a lot of our respiratory care and treatments that we normally do have changed, but you're still going to get treatment. You still, we've changed to breathing instead of a Zopanex treatment, and we're changing to just a couple of different lines of respiratory treatments that we will do instead of our normal breathing treatments and things that we've done in the past.
Okay.
So we may ask for your meter dose inhaler. So if you have one, you have a respiratory compromise, we'll probably ask for that to assist us in getting some ease of breathing through a tube. And it's kind of like an handheld nebulizer, but we're going to giving it through the tube portion of it through your meter dose, and that keeps the droplets down.
Okay. All right.
So
I really like that you said that treat everybody as if you treat each patient as if they are positive COVID case. And I think that's something that we need to do as we're going through this. If we want to keep our cases down here in Scurry County, is treat everybody as if they're a positive case. That doesn't mean just totally stay away from everybody. Don't talk to anybody, but wear your mask, wear your protective equipment, stay 6 feet apart when you're out in public, that type of thing. Treat everybody as if they might possibly have COVID.
Well, that's the golden rule. Love your neighbor as yourself, but
Right.
it doesn't mean that we have to be rude and disrespectful at the same time. We just it's something that as a pre-hospital care provider, I've been doing it for a long time. That if you treat others as you want to be treated, you generally get a better response back. You're calm, we're calm.
Yes.
When we're calm, and then that allows you to be calm. It's your emergency, not ours, number one. But we're going to try to provide the best care that we can so that your health and safety is top priority and taken care of, and that we get you to the most appropriate facility to care for whatever emergency that you're in. I mean, helicopter's still flying.
Yeah.
We're still taking care of trauma patients. We're still using the healthcare facilities and resources that are at our exposure. It's just some of the things are different. Some of the treatment methods, some of the precautions due to COVID-19 are a little different. However, everything else is still running similar. But yeah, we're still running the things that we do. We do have that reserve truck, which makes it really nice to pull from. And so Scurry County is really lucky to have a proactive ambulance service that is supported by its community and the county, by the county court. So it's very helpful, and it's a lot easier for me to do my job and to provide better quality patient care to y'all too.
And I've said this before, I would put our EMS service, you and our EMS service, against any in the state and probably nationwide. So
I appreciate it. We're striving hard.
Yeah, you are appreciated. Y'all do a good job. And that's all I have, unless you have anything else.
So there's a survey. We have a survey that's going out. Scurry County EMS is doing a survey based on the COVID-19 response, as well as just our general survey. So if we run on you and we transport you to a hospital and you get one of these surveys, please fill it out honestly. We're always looking at different ways to better our job and the better way that we can treat you. So please fill that and send that in. We've had a lot of community support. There's been Little Caesars, the Sweet Shop, Dan and Dee Chasteen, Dana Fantrap, Glennon Hollingsworth, Troy Lilly, Jimmy and Pamela Wilson have all come through, delivered food to our guys. The last month has been a very trying month for us. We've worked a lot of hours trying to get prepared for whatever is going to hit us, and we thank you for their support as well as the other community support that's helping. We're trying to do a good job. We're trying to keep y'all safe as well as keep our medics safe. And so thank you. Appreciate it.
All right. Well, I guess that's all we have for today. We'll do this again tomorrow at 4:00. I don't think Jason will be here. He's going to be back out at work. I'm going to have somebody else in here with me. Still to be determined, but we'll talk to you again tomorrow.
Thank you.